Tonight's webinar is by Special Olympics Ontario, which provides year-round sport and health programs to 25,000 people with intellectual disabilities across the province. Our speakers tonight are Shafiq Armstrong, Yiwen Xiao, Dr. Nadine Furtado, and Caleb Deneau. Shafiq Armstrong has worked as a program developer for 4 years at Special Olympics Ontario and is excited about building a level of inclusive health for people with intellectual disabilities. He has just completed a Master of Public Health at the University of Toronto Dalla Lana School of Public Health. Yiwen Xiao is a program developer at Special Olympics Ontario. She has a Master of Public Health degree from the University of Toronto and is interested in matters of health equity and social justice, particularly as they relate to the health and well-being of people with disabilities. Dr. Nadine Furtado is an assistant clinical professor at the University of Waterloo School of Optometry and Vision Science, where she is head of the Ocular Disease and Imaging Service. She earned her Doctor of Optometry and MSc in Vision Science from the SUNY College of Optometry. Dr. Furtado is a fellow of the American Academy of Optometry, a clinical director for Special Olympics Ontario, and a member of the board of directors of the Vision Institute of Canada. Caleb Deneau has been a Special Olympics athlete for 12 years. He has competed in the 2016 Provincial Spring Games, as well as the 2018 National Intramural and Recreational Sports Association Championships. In addition to being a Special Olympics athlete, Caleb has worked as an intern at Special Olympics for 2 semesters. He is a strong advocate for people with intellectual disabilities, including improving their access to health care, and hopes to become a sports journalist. Welcome, everyone.
Good evening, everyone, and welcome to our webinar on Special Olympics Ontario, Healthy Communities, Healthy Eyes, a pilot project to improve access to eye care for people with intellectual disabilities. Next slide. As Cheryl mentioned, there will be 4 of us presenting on today's webinar. We have Caleb, Shafiq, myself, Yiwen, and Dr. Nadine Furtado. Next slide. We have 4 main objectives for this webinar. By the end of this webinar, you should, number 1, understand Special Olympics Ontario and its health programs. Number 2, obtain strategies that you can use to adapt your care for people with intellectual disabilities. Number 3, understand the Healthy Communities, Healthy Eyes pilot project. And number 4, understand how you can contribute to a more inclusive health system. Next slide. On today's agenda, we will start by introducing you to Special Olympics Ontario. We will then discuss the eye health of people with intellectual disabilities. After that, we will talk about some communication strategies you could potentially use in your practice to improve the care for people with intellectual disabilities. And finally, we will introduce you to our exciting new pilot project called Healthy Communities, Healthy Eyes, and let you know how you can get involved. Next slide. So to begin, we will introduce our organization. Next slide. Special Olympics is a worldwide organization that provides sports training and competition for people with intellectual disabilities. Our mission at Special Olympics Ontario is to enrich the lives of people with intellectual disabilities through sport. There are approximately 25,000 Special Olympics athletes in Ontario that are supported by 10,000 coaches and volunteers. Athletes range from 2 years old to 88 years old, with about half of our athletes under the age of 22. Next slide. So what is an intellectual disability? In Ontario, the terms intellectual disability and developmental disability are often used interchangeably. They refer to significant impairments in both intellectual functioning and adaptive behaviors. Intellectual functioning includes reasoning, learning, and problem solving, and is typically assessed with an IQ test. A score of less than 70 would indicate an impairment in intellectual functioning. Adaptive behaviors refer to conceptual, social, and practical skills. Conceptual skills include skills in language, reading, or math. Social skills include interpersonal communication and empathy, while practical skills include areas of self-management. These impairments must occur before the age of 18 and significantly impact an individual's ability to carry out daily activities such as personal care and social interactions. Some examples of intellectual disabilities include Down syndrome, Fragile X syndrome, Prader-Willi syndrome, and fetal alcohol spectrum disorder. Next slide. About 1 to 3% of the Canadian population has an intellectual disability. Next slide.
Hi everyone, this is now Shafiq Armstrong, the other health program developer at Special Olympics Ontario. So in addition to running sport programs, Special Olympics Ontario also has a number of health initiatives. 2 of these programs are, number 1, the Healthy Athletes program, and number 2, the Healthy Communities program. We will discuss these programs in more detail over the next few slides. Both of these programs arose from the growing recognition that people with intellectual disabilities experience poorer health than people without intellectual disabilities. These health differences are often referred to as health inequities because they occur as a result of inequitable access to important determinants of health. This includes challenges in accessing health promotion opportunities and quality healthcare services. Barriers include financial barriers, programs that are not adapted for people with intellectual disabilities, and communication challenges. One particularly alarming statistic is that people with intellectual disabilities die 16 years prematurely because of undiagnosed and untreated conditions. Again, this statistic is not due to their disabilities, but because of inadequate health promotion opportunities and supports. Next slide. The Special Olympics Healthy Athletes program provides free health screening and education to Special Olympics athletes across 8 different disciplines of health. Healthy Athletes is overseen by healthcare professionals who have been trained by Special Olympics and with the help of health professional students and practicing healthcare professionals, such as optometry students and optometrists. Healthy Athletes is provided year-round in conjunction with Special Olympics sport tournaments across the province. This provides a fantastic opportunity for both students and health professionals to gain more practical experience caring for people with intellectual disabilities in their respective health discipline, and no previous experience is required. Next slide. The Healthy Athletes Opening Eyes program provides eye screenings to Special Olympics athletes and other people with intellectual disabilities. On the slide, you will see 2 photos of the program in action. Overall, the program aims to identify any unmet eye care needs an athlete or another person with an intellectual disability may have, and then refer them to an optometrist in their community to receive a complete eye exam when necessary. Opening Eyes is facilitated by a clinical director. A clinical director is an optometrist who has received training from Special Olympics to lead the event. On the day of the event, we also recruit other practicing optometrists and optometry students to participate, which provides them the opportunity to interact with people with intellectual disabilities, a population they otherwise may not have had the opportunity to engage with. Research demonstrates that 84% of health professionals, including optometrists, feel more confident in their ability to care for people with intellectual disabilities after volunteering at a Healthy Athletes event. Next slide. Despite the benefits that Healthy Athletes has offered to athletes and healthcare providers involved, people with intellectual disabilities continue to experience health disparities. Healthy Communities was developed to address these disparities and work in conjunction with the Healthy Athletes program. Healthy Communities aims to, number 1, improve the health status of people with intellectual disabilities, and number 2, increase access to quality health services for people with intellectual disabilities. Through this project, we have been partnering with healthcare providers and health professional associations to improve how health services are being delivered to people with intellectual disabilities. We are also supporting athletes to connect with health professionals in their communities to receive care, for example, through our Healthy Communities Healthy Eyes pilot, an initiative that we will be discussing in more detail later in this webinar. Next slide. Please launch the first polling question. So intellectual disabilities refer to having an IQ below 70 to 75, impairments in adaptive functioning only, impairments in intellectual and adaptive functioning, impairments in communicating, or impairments in listening and speaking. Great. So as we noted in slide 7 of this webinar, intellectual disabilities refer to impairments in intellectual and adaptive functioning. Intellectual functioning includes reasoning, learning, and problem solving, and adaptive behaviors refer to conceptual, social, and practical skills. Conceptual skills include skills in language, reading, or math. Next slide.
Okay, so this is Nadine Furtado now. For the next few slides, what I'm going to be talking about is just eye health in general for people with an intellectual disability, as well as how by making simple modifications to a standardized eye examination, you can facilitate seeing individuals who do have these intellectual disabilities. Next slide. So probably the 3 most common systemic conditions that are seen with individuals with intellectual disabilities would be Down syndrome, cerebral palsy, and individuals who are on the autism spectrum disorder. So with Down syndrome, obviously that is a genetic disorder. These individuals have a 3rd copy of that chromosome 21. And as a result of that, in addition to the characteristic facial features that are usually seen in this population, there are delays in physical growth, as well as varying degrees of intellectual disability. It's usually in the range of mild to moderate. As far as ocular health and visual health are concerned, the most common ocular conditions seen in individuals with Down syndrome would be high amounts of refractive error and strabismus, as well as amblyopia, accommodative dysfunction. And as far as eye health is concerned, they're at higher risk of keratoconus, recurrent keratitis, cataracts at a younger age, as well as chronic eye infections. When we're talking about cerebral palsy, so that's a movement disorder that includes poor coordination and weakening of the muscles. Similarly, these individuals are at higher risk of having high refractive errors and strabismus, as well as amblyopia, accommodative dysfunction, as well as higher rates of nystagmus and just overall abnormalities to the posterior segment. And then finally, when we're talking about autism spectrum disorder, as the name implies, it is a disorder along the spectrum. And so there's going to be a range of the manifestations of this disorder, but they're all ultimately due to issues as far as neurodevelopment is concerned. And then as far as eye health and visual health are concerned, so once again, high incidence of refractive error, as well as keratoconus. And these individuals often have issues as far as attention is concerned, and that also translates as far as vision is concerned. So you do see visual attention disorders, eye movement disorders, and visual symptoms related to behavior. Next slide, please. So as far as examining patients with an intellectual disability, as optometrists, we are all trained to see this patient population. But just because of some of the challenges that can often arise when we are examining these individuals, all optometrists may not necessarily be as open or feel as comfortable examining these patients. So oftentimes, individuals with an intellectual disability will have numerous complex ocular conditions. And so that can make the eye exams in and of themselves more challenging from that perspective. And just given some of the cognitive impairments, that can also be another challenge. So overall, it can make the eye exam a bit more time consuming. And one of the main things is just proper communication throughout the eye exam. Oftentimes, the patient's sort of reaction or behavior can be misinterpreted as being disruptive or non-cooperative, but oftentimes it's just because they're not fully understanding what is going on or what is being asked of them. So communication between the doctor and the patient is crucial. And so overall, that is going to take more time, and it is going to require more patience. But if you're able to make these small modifications to your standard eye examination, it'll definitely allow for a more positive experience and overall more improved successful outcome as far as both the patient and the clinician are concerned. Next slide. So for the next 2 slides, I'm just going to briefly overview, just as an example, some of the minor changes that you can make to your eye examination, just once again to facilitate seeing an individual who has an intellectual disability, and really just to make it easier as far as acquiring the clinical information that you need as part of your examination. So one of the first things to note is, as far as the whole consent process is concerned, a lot of these patients will come in with their legal guardian, be it either their parent or their caregiver. And so they're the ones who are going to be consenting for the exam. But the patient in and of themselves does have the right to refuse any procedure that is being performed on them. So it's a matter of just being respectful of that even though the caregiver has given consent for the examination, you always want to be mindful that the patient does have the right to refuse any sort of test or procedure that's being proposed. From a visual acuity standpoint, for a lot of these patients, the traditional Snellen visual acuity chart may not be the most appropriate as far as achieving the appropriate result that you want. So you will have to potentially adapt that either by using a different chart or by also considering, as opposed to showing the full chart, either going to single line or single letter, once again, just to help as far as fixation and assessing visual acuity. We're talking about visual field and confrontation visual field testing. That might not necessarily be possible, but you do want to be able to assess the patient's useful visual field. So by simply changing the target and being able to assess visual function in the different fields of gaze, that would provide you with useful information as far as your exam is concerned. When I listed a lot of the ocular conditions that are seen in this population, a lot of them had to do with binocular vision. So proper assessment of the binocular vision system is obviously very crucial in these patients. Doing your standard cover test may not be possible, so alternative testing methods need to be considered. Some of the light reflex tests, so your Hirschberg, Bruckner's, Krimsky, are really good options in order to give you an assessment of binocular visual status. And then also just assessing for functional binocular vision. So assessing for random dot stereograms, Worth dot can provide you with a lot of useful information as well. Next slide. When we're talking about refraction, for a lot of these patients, your subjective refraction won't be necessarily possible. So you're going to rely more so on your objective findings. That being said, there are some of these individuals who, from a cognitive standpoint, will be able to perform a subjective refraction. So you don't want to necessarily rule it out, but just being mindful that for most of these patients, you are going to rely more on your objective versus your subjective findings. And just given the higher prevalence of ocular disease in this population, you do want to make sure you're doing a thorough ocular health assessment. For most of these patients, you are going to have to get a bit more creative with your exam techniques just to be able to properly assess both the anterior and posterior segments. Definitely doing a dilated fundus exam will help with that posterior segment assessment. You probably still won't be able to get views in all quadrants, and most likely will be still getting fleeting views of the posterior segment, but it'll definitely be easier with doing a dilated fundus assessment as opposed to an undilated one. And then also you do want to make sure you're getting an accurate assessment of intraocular pressure. Doing digital in this patient population may not necessarily be sufficient just because of the higher possibility of glaucoma. So you do doing a Goldman or applanation tonometry or even NCT might not be possible just because of what is required as far as fixation and sitting in the instrument. And so if you have the option of using a handheld tonometer, that is probably the better option as far as getting the most accurate assessment of intraocular pressure. And then finally, just as far as thinking about prescribing glasses for these patients, as opposed to prescribing a final RX based on sort of their presenting behavior and their perceived capabilities, you would really want to prescribe a pair of glasses that's going to essentially maximize and provide the patient with the best functional vision, just to allow them to achieve their full potential as far as visual function is concerned. So like I said, just sort of a brief overview or just a few small things that you can do to adapt your standard eye exam just to make it a bit easier to examine individuals in this patient population. But overall, the main thing is just really the clinician's approach to the exam and just sort of making small changes to how you communicate and interact with this patient population just to make it a more positive overall experience from their standpoint. Next slide. So what I'm going to do now is I'm just going to pass it back to Yuan, who's going to talk about some of the more ways you can go about communicating with individuals with an intellectual disability.
Next slide, please. So healthcare providers often talk about communication barriers as being a key challenge to providing care to patients with intellectual disabilities. And this is true across all health disciplines. People with intellectual disabilities vary in their ability to understand and verbalize language. Further, they vary in the range of communication methods they prefer to use, from nonverbal to verbal communication, and this can be challenging for healthcare providers to navigate. Next slide, please. A while back, we held a focus group with a few people with intellectual disabilities to talk about their experiences in healthcare settings. So on this slide, you will see some of the quotes that came out of that conversation. So for example, one participant suggested, "Slow down the tempo and talk to me in human terms, not doctor terms, and explain the side effects to me as a human being." Another participant said, "If they don't explain it to me, I get nervous, I get jumpy." So in the next few slides, Caleb will talk about some ways healthcare professionals, including optometrists, can improve communication with patients with intellectual disabilities. Next slide.
Hello, this is Caleb Deneau, Special Olympics athlete speaking. In the next few slides, we will discuss the following 4 strategies. Number 1, establish rapport. Number 2, choose appropriate language. Number 3, listen to your patients. And number 4, communicating without words. Next slide. Strategy 1, establish rapport. Establishing rapport with your patient at the start of their visit is critical as it will help you gain your patient's trust. The first step to establishing rapport is to acknowledge your patient. Speak directly to the patient, even when they come in with a caregiver. If it's necessary to involve the caregiver, it is okay to do so, but make sure that you're still engaging with the patient. Keep making eye contact with your patient and keep them involved in the conversation. Start your conversation with some simple introductory questions like, "How was your day?" or "What's your favorite TV show?" Getting to know your patient better will help them connect with you. This is also a great opportunity to familiarize yourself with how your patient communicates. Ask your patient what they need to feel comfortable and make sure to encourage your patient throughout the appointment, letting them know when they are doing a good job. Next slide. Strategy 2, choose appropriate language and explain what you are doing. It's important to talk to your patient throughout the appointment. Tell them what you're going to do before you do it and explain why you have to do something. When communicating with people with intellectual disabilities, try using short sentences in simple, everyday language, avoid medical jargon, speak slowly and clearly, but avoid using an exaggerated tone. Be repetitive. It's often helpful to explain something a few times. Try to find different ways to explain the same thing. Use an active voice rather than a passive voice. For example, say, "The eye doctor will examine your eyes," instead of, "Your eyes will be examined by an eye doctor." Use concrete language and avoid being too abstract. For example, use phrases like "show me" or "tell me" that are very direct and get straight to the point. Ask questions like, "Are you nervous?" instead of, "How are you feeling?" Next slide. Strategy 3, listen to your patients. Listening is an important part of communication. Some people with intellectual disabilities may need more time to express themselves. Be patient with them. In recognizing that an optometry clinic can be quite busy and that there are often time constraints, rushing the patient might make them more anxious, which could possibly delay the process even further. If you know you will be seeing a patient with intellectual disability ahead of time, try allocating some extra time for the appointment when possible. When talking to your patient, if they tell you something that you don't quite understand, ask for clarification. This will show your patient that you really do care about what they have to say. Answer your patient's questions. While this may seem obvious, it's quite common for people to assume that a person with intellectual disability might not understand their explanation on something, so they will only provide a partial answer or may even dismiss the person completely. Explaining complex ideas or processes may require some extra time and creativity in the language you use, but it's important for patients with ID to be given information about their health and what they can do to promote their health. Check in with your patient regularly to make sure that they understand what is happening and to see if they have any concerns. Next slide. Strategy 4, communicating without words. As previously mentioned, people with intellectual disabilities vary considerably in how they communicate, and therefore it's important to use both verbal and nonverbal forms of communication. To begin, recognize that all behavior is communication. This is particularly true if you see that your patient is exhibiting disruptive behavior. It's usually because the patient is trying to tell you something. Perhaps they feel like they are not being heard, or they may have something to tell you but are unsure about how to communicate it to you verbally. Getting at the root of the behavior isn't always easy. Be attentive and consider the events that led up to the behavior. If you can, ask the patient what is wrong. If the patient is with a caregiver who knows them well, the caregiver might be able to help you. Other times, these negative behaviors occur because the patient is taken by surprise. To prevent this from happening, make sure to prepare your patients for what is to come. Tell and show your patients what you are about to do before you do it. If you can, provide a demonstration. If you have visuals and diagrams that you can show your patient, those would be very helpful. Use gestures when you are explaining something. Show the patient the equipment that you will use before you use it. When possible and safe, allow the patient to handle and explore your equipment. Next slide. Now, we would like to show you a Special Olympics communication video that will summarize what I've just spoken about. Next slide. Launch the video, please.
Inclusive health is a journey. We can all take action to remove barriers and improve access to health services for people with intellectual disabilities. But sometimes it's hard to know where to start. And that's why Special Olympics has developed 4 key strategies to help you. These strategies include welcoming spaces, communication, awareness and training, and sustainable and intentional inclusion. Accessible communication is one of the first steps you can take to include people with ID in your programs and services. Ensuring your communication, including written communication, is accessible to people with intellectual disabilities is critical to ensuring equitable access to health services. There are a number of actions you can take to make your communication accessible to all patients, including speaking directly to the individual, not his or her caretaker, using plain language, written materials at no more than a 6th grade reading level, avoiding jargon, acronyms, and abstract statements, incorporating pictures to show meaning, providing in-person assistance to ensure patients understand materials and can complete forms, including images of people with ID in your promotional materials. At the Complex Care Center at the University of Rochester, proper communication starts even before the patient comes in.
So when a patient or caregiver reaches out to our clinic for a new patient visit, for example, for primary care, we call them to book that first visit. We call them 2 days before and make sure we've identified any caregivers that might be giving them rides or support during that visit, so we can also contact them for reminder calls. And then at the first visit, they're invited to check in on their own with the support of their caregivers if they bring them with them. As the secretary is checking them in, she will outline to them that they're going to work together, she is the secretary, to help them check in independently in the future.
They understand their patient is, in this case, my son, but they also understand that as a caregiver, we need to be included in the process, but it's nice that Tim is the main focal point.
At the East River Road Clinic at the University of Rochester, a clinic that is specifically for pediatric patients, staff are trained to communicate with patients in an accessible manner.
We teach our staff about things like using visual support so that you can have a visual. When I check them in, they know they need to take their shoes off. Then we do weight, then we do height, then we do blood pressure, and sometimes we need a head circumference. So they look at the pictures and they go right down them and they know what's expected. And that helps. We teach them things like first then approach. So first take your shoes off, then I will grab you a toy. Making it calm, clear, and precise. And routine. Every time a child comes in, make it routine. They know what to expect. I love working with patients who aren't verbal, and most of my patients are not verbal. It can be really fun to interact with them, and families are so appreciative when providers just take the time to do that. And so the things I think of when working with a child who's nonverbal is starting off by getting at the child's eye level so that they're looking at you directly, and speaking to the child as you would any other child. Most children will really respond to that, and really making sure to continue to include the child in the whole visit and check in with the child, that no parent wants to feel like their child is being ignored during a visit.
The most rewarding part of my job is seeing the smiles on patients' faces when they're happy. A lot of the patients are nonverbal, so when you get the smiles, you know that they're content.
The people here, everyone's so friendly. They listen to me.
I can talk to the doctors here because they respect me, listen to me, and make me feel comfortable.
Remember, using accessible communication helps not only patients with ID, but all members of your community. For more inclusive health strategies, visit www.inclusivehealthcenter.org. Everyone has the same right to health. Don't wait for someone else to make it happen. Join the inclusion revolution.
To end this section, I wanted to tell you about a really good experience I had with an eye doctor and some things she did to make the visit comfortable and enjoyable. I went to a neighborhood optometrist referred by healthy athletes for a complete eye examination. My family and I let the optometrist know that I have autism and that some of the procedures could make me uncomfortable. She was very kind and understanding, even though I was experiencing sensory overload and had a minor anxiety attack. I had an outburst when she put drops into my eye, but she understood that this outburst was not done out of malice and was simply because I was feeling stressed. She made me as comfortable as could be during what was, in parts, a stressful checkup, and also managed to get the data that she needed. Instead of acting impatiently or forcing the procedure when I wasn't ready, she spoke and listened intentionally to me and showed respect, patience. I think these strategies helped my optometrist facilitate a smooth appointment. In short, the training that people need in order to deliver good healthcare to patients with intellectual disabilities is not very extensive. It is just a few techniques and tips that you need to learn, and once you do learn them, they will be invaluable. We've also summarized the communication strategies we just discussed into a fact sheet that you should all receive. Now, we would like to move on to 3 polling questions. Next slide.
So please launch polling question number 2. So polling question number 2. So which of the following is false? When communicating with a patient with an intellectual disability, you should speak slowly and clearly, speak only to the caregiver if a caregiver is present, use visuals and gestures to explain what you're doing, familiarize with the patient's preferred communication method, or E, speak using non-technical terms. Fantastic. So as Caleb noted in his slide, it's really important to speak directly to the patient and not just to their caregiver. All the other answers are true and important when communicating with a patient with an intellectual disability. So please launch polling question number 3. So polling question number 3. If your patient is exhibiting disruptive behavior, you should first ignore the behavior and finish the appointment. Be attentive and consider the events leading up to the behavior. Ask the patient to take some time for themselves. Or D, consult a caregiver immediately. So while C and D are not bad ideas, B is the best answer here. It's very important to be attentive to the patient and really consider the events leading up to the disruptive behavior to inform what you're going to do next. And please launch polling question number 4. So negative behaviors often occur because the patient is taken by surprise. To prevent this, you can tell and show your patients what you are about to do. Use visual aids and simple diagrams. Use gestures and point. When possible, allow the patient to explore equipment. So answers A through D are great strategies to help guide your patient along to prevent negative behaviors and to prevent your patient being taken by surprise. Next slide.
So for the next few slides, I'm going to be talking about the Healthy Communities, Healthy Eyes initiative and the pilot project that we've launched within the past month. Next slide. So the Healthy Communities, Healthy Eyes initiative was launched for a few reasons. As has already been noted, research shows that people with intellectual disabilities experience poor eye health compared to the average population. And so some of the they do experience more visual impairment, both as far as ocular health is concerned, as well as visual function. And so they're more likely to have ocular disorders related to the ocular health status and refractive error and binocular vision. In addition, studies have shown that not only is there a higher prevalence and frequency of eye disease and visual impairment in this population, but they're more likely to have untreated eye conditions as well. So not only is it more common to see issues as far as vision and ocular health within this population, but it's also more likely that these individuals who have these conditions are going to go undiagnosed and untreated. The other issue is that just the challenges that exist as far as identifying individuals with intellectual disabilities who do have these visual and ocular conditions. Part of that has to do with the fact that oftentimes these patients are unable to properly articulate that they're having symptoms or they're having difficulties with their eyes. And so that in and of itself is going to make it harder to be able to identify these conditions and properly diagnose and treat them. And the other one has to do, just as was previously mentioned, some of the challenges as far as finding an optometrist who's open to seeing this patient population. And so that's some of the main reasons why we wanted to start this Healthy Communities, Healthy Eyes initiative. Next slide. So we also know that people with intellectual disabilities and their families, like I said, often struggle to find an optometrist. So from our pilot study, it's estimated that about 85% of families participating said that they do struggle to find an appropriate optometrist for either themselves or a family member with an intellectual disability. And there are various reasons for this, anything from financial barriers to just finding an optometrist who's going to be a good fit for them, or just sort of navigating the healthcare system and finding someone who's appropriate. And like I said previously, all optometrists are trained to see this patient population, but just because of some of the challenges that come about in the examination, all optometrists may not necessarily be as open or maybe somewhat hesitant to see these patients for eye exams. And so that's one of the main impetuses as far as starting this Healthy Communities, Healthy Eyes initiative. And essentially what our main goal and objective is to be able to properly align optometrists, properly align these athletes with optometrists in their communities who are open to seeing them. And these optometrists are aware of some of the potential challenges around communication and testing that can occur, but they've signed up for the program and they're aware of this, and they're willing to take the necessary steps in order to adapt their examination style as needed to make sure that the athlete is comfortable in that exam setting. Next slide. So our Healthy Communities, Healthy Eyes pilot project launched a little over a month ago in the GTA. And so essentially what it is, it's an online web platform where these athletes are able to go and register and subsequently find an optometrist in their community who's open to seeing them for an eye exam. As part of our pilot project, we have approximately 25 athletes who have registered, and we have about 5 optometry clinics within the GTA who have made themselves available to connect with these athletes or individuals with an intellectual disability who are looking for an optometrist. And so essentially what you're seeing on the slide right now is the athlete slide at the side of the portal. Once these athletes are registered in the program, they're able to log onto the website and search for an optometrist located in their area. They simply have to enter their address and in the search box and the names of all the optometry clinics in their area, as well as the optometrists at those clinics who are willing to provide care to them will pop up, and they'll be able to choose an optometrist and subsequently schedule an eye exam. Next slide. So once the athlete has chosen the eye clinic that they want to go to, they're given they see a page similar to what you're currently seeing on your screen. So they have 2 options as far as scheduling an eye exam. They can either email the clinic or call the clinic. If they choose to email the clinic, they just click on that click me to email button, and essentially what happens is a pre-populated email automatically forms with their information will appear, and that's what you're seeing on the right hand side of that screen, and the athlete just simply has to press the send button, and that email is going to be sent to the clinic, and the clinic will then get that cue to call back the athlete to schedule that appointment. Or the alternative is that the athlete or their caregiver can just directly call the clinic in order to schedule that appointment. Next slide. One of the other things that this Healthy Communities, Healthy Eyes initiative is allowing us to do is giving us the opportunity to potentially collect data on this patient population. So when athletes register to be part of the program, they're given the opportunity to consent to have some of their information from their eye examination shared with Special Olympics Ontario through this website portal. So this is not mandatory, it's completely optional for the athletes. They are able to opt out. But if they do consent, some of their information from their examination will be anonymized and will be collected, like I said, solely for research purposes. And so essentially the optometrists who have signed up for this program, they agree to complete a quick patient exam form following the examination. It takes about 2 to 3 minutes to complete, and it's just some of the basic information that we're hoping to be able to collect from this initiative as well. What this is going to allow us to do is, on a long-term longitudinal basis, it's going to allow us to collect information about this patient population, just to help us better understand the eye care needs of individuals with intellectual disabilities, so that hopefully it can inform us for future initiatives so that we can improve the eye health of these individuals, as well as possibly impact policy in the future. Next slide. So I'm just going to send it back to Shafiq now, and he's just going to talk about some of the initial findings that we have from this pilot project.
Perfect. Thanks, Nadine. So what are we learning so far through this pilot? So while people are still booking appointments using the website that Nadine just went through, and then going for those appointments, people that we've connected with have let us know that they've found it easy to use the website and to make an appointment. Everyone that we've spoken with has had a positive experience with the optometrist that they booked an appointment with. One piece of feedback that we have received is that families and athletes would be keen to find some more options when selecting an optometrist, so they don't have to travel as far. We've also received quite positive feedback from the optometrists who are participating in our pilot so far. Next slide. So what is our goal? Our goal is really to close the gap in health inequities, including but not limited to the differences in eye health between people with intellectual disabilities and people without intellectual disabilities. And our vision to do this, in part, is creating a network of health professionals, and that certainly includes optometrists across Ontario who are open to seeing patients with an intellectual disability. And we do this by making sure health professionals are confident and are able to access resources that they need on adapting their care. By doing this, we are working towards a more equitable and inclusive health system for everyone. Next slide. So please help us improve the eye care for people with intellectual disabilities by joining our Healthy Communities Network. Please connect with us after this webinar to become a Special Olympics Ontario Partner in Health and make it easier for people with intellectual disabilities and their families to connect with an optometrist and receive eye care. Next slide. So we hope you enjoyed the webinar and you now feel you have a few more strategies to employ when caring for people with intellectual disabilities. We have also provided you with some resources, including a one-page strategy sheet and links to some helpful videos on adapting your care for people with intellectual disabilities. Next slide. So on behalf of myself, Shafiq, Calum, Ewan, and Dr. Nadine Furtado, thank you very much for watching our webinar.
I will now share the questions you have submitted. The first question, what is your plan after you receive the results of pilot?
So we hope to scale this pilot to other areas of the province, so all athletes and others with intellectual disabilities can connect with an optometrist. But certainly to do this, we need optometrists who are interested in becoming a partner in health with us across Ontario.
Thank you. We have another question. Can optometrists practicing inside or outside of the GTA become part of the Healthy Communities, Healthy Eyes initiative?
Yeah, so they certainly can. So while we're still finishing the GTA pilot, we'll be finished in December. We certainly encourage all interested optometrists to connect with us if they would like to be part of the next phase.
The next question, how do you get on the list?
You can connect with us. Our emails are on the screen. You can either contact myself, Shafiq, or you can contact my colleague, Ewan.
Great, thank you. We have another question. What are 3 communication strategies I can use to better adapt my care for people with intellectual disabilities?
Yeah, it's a great question. Number 1, I would say speak directly to the person with an intellectual disability, not their caregiver. A second one would be to establish rapport with the person with an intellectual disability. Often we suggest starting with a question totally unrelated to the procedure, and Calum noted this within his slides. And number 3, it's really important to guide the person through the process. Let them know what you're doing and why, more specifically, the significance of what you're doing.
Mm-hmm. I've got another question. How many patients with intellectual disabilities would you anticipate we might see per month with this project?
That's a great question. As of right now, with the optometrists who are participating in the pilot, the most that the optometrists have seen have been about 4 to 5 patients. And that's what we assume other optometrists would see as well.
Thank you. I'm just checking to see if there are any other questions. Do we have any other questions from those on the line? We have a few minutes left in our hour. Just want to remind you there are some handouts that you have available, and there's links to some videos, as Shafiq mentioned. If there are no more questions, I'd like to thank the speakers for this insightful presentation and Special Olympics Ontario for partnering with the OAO for tonight's webinar. The webinar will be posted on the OAO website within the next few weeks. As you log off, please complete our survey. We'd love to have your feedback. Oh, I see we've got another question. Is there a way we might be able to contact other ODs participating to be able to discuss their experience?
I'm guessing that's meaning the participating optometrists in the pilot.
Yes.
Yeah, I would certainly just would want to check with the optometrists who are participating before I provide their information. But that's certainly something I can check with them, or Nadine can connect with them as well. So maybe if the person who's asking the question can send an email to either myself or Ewan, I can ask the participating optometrist if they'd be willing to share that information.
Sure. So the first step is to contact you. and then you can perhaps facilitate that.
Absolutely, but thank you
Thank you.
very much for your interest.
Yeah, thank you. Well, thank you for joining us tonight. Thank you, everyone. Good night. Thank you.